We are all so busy that it can be tempting to simply take a shot at the first vein that appears. However, if you take your time selecting a good vein, especially in a patient with difficult veins, then you will cut down the time your actual procedure takes. In peripherally shut down patients, the veins can take a long time to fill, so get your tourniquet on early and look in all the typical spots for a decent vein, like the back of the hand, the forearm, don't forget the back of the forearm, the antecubital fossa, and if you still haven't found anything worth attempting, then see if the other arm is any better. Speaking of vein selection, remember that you are trying to increase the pressure within the veins, and the best ways to help with this are to increase the blood flow, which is the reason why we get patients to open and close their hands, and to use gravity. So I like to get the patient to hang their arm over the side of the bed down low to get those hand veins to come up. Likewise, gravity is useful at the end of the procedure when you don't want to spill blood everywhere. Simply lift the arm higher while you apply a bit of pressure at the cannula tip, and you won't spill a single drop. There are so many ways people use to get a vein to come up nicely, but some of them can be quite painful. We don't need to cause pain to get the vein to come up nicely. A little bit of gentle irritation will do. Just imagine that the vein is like a string that you will pluck. Remember, the blood flow is really slow if you have a tiny, difficult vein. This means your flashback will come very slowly too. Very different than if you cannulate a large vein with a large cannula, where the flashback is virtually instantaneous. This is probably my top technique tip. Get this right and you will realize that you can safely advance the needle a decent distance into the vein before pushing the cannula off. This will ensure that you, A, are able to ensure that the cannula is in far enough that you can safely push it off, and B, you don't go through the deep wall. No more blown veins. It's quite tricky to explain, so I'll have to use this picture to help. Basically, once you get the flashback, you will then flatten the angle of the needle and simultaneously lift upwards as you push the whole needle forward. The arrow in the picture helps to illustrate the direction of the force that you are using. So there you have it, my top 5 tips for peripheral venous cannulation. Of course, many others will have loads more helpful tips too. But I just hope that these can help you take your cannulation game to the next level.